The last thing you want to hear when you need your auto insurance most is a robot with countless irrelevant menu options. Which is why with USAA Auto Insurance, you'll get great service that is easy and reliable, all at the touch of a button. Get a quote today. Restrictions apply.
Welcome to Raising Me, where we talk about the joys and the challenges of raising kids today and bring in the experts to help us out. I'm Adrienne Stein, a mom of 3, ranging in age from 6 to 17. And as we get started, a big thank you to our sponsor of Maine Health. Today, we are talking about something that a lot more families are navigating right now, and that's how to support your child through therapy. Maybe your child is recently started to see a therapist, or maybe you're just starting to consider it, wherever you are, but perhaps you're wondering, what is my role in all this? Should I be in the room? Am I helping, or am I getting in the way? Well, our guest today is Jacki Charity. She is the director of outpatient and substance use disorder services at Kennebec Behavioral Health. She is a longtime advocate and expert in behavioral and mental health for children and families. And she's here to help us navigate how we as parents and caregivers can become helpful, be partners in a child's therapy, while also giving the kids space that they need to grow and to process. So whether your child is 5 or 15 or 18, she has some wisdom to share with all of us. Check it out. Jacki, thank you so much for joining us. I'm really excited to talk to you about this topic. But before we jump in, tell us a little bit about you and your experience, particularly why you feel so passionate about helping families and children navigate this.
Well, I've worked in a variety of places over a number of years, and just have always seen that there's a lot of need for services for children and families. I have experience in a residential treatment facility. I provided in-home services for at-risk children and families. I worked in a hospital for uninsured, looking for resources for uninsured individuals, and found my way to Kennebec Behavioral Health in my internship, and stayed here after that was completed. So I've been here for 22 years at this point.
Which is so impressive. When it comes to the mental health struggles that children, young people in particular, are having, how common are these struggles right now?
Well, there's some really good information on websites like the CDC that provides statistics and information, although they're a little bit dated. But the CDC estimates that up to 10% of children from 3 to 17 struggle with anxiety. 7% of children in that same age range struggle with depression. And 7% struggle with behavioral challenges, and about 4 or 5% struggle with depression. So those are pretty significant numbers, indicating that our children are really struggling with mental health and behavioral challenges.
Are you finding it's, we heard so much during and immediately post-pandemic that a lot of children were, anxiety was something we heard so much about. Is your research, is your experience that this is still tied to sort of the post-pandemic, or is it something else?
In my opinion, I think it might be. I don't feel that those numbers have improved or come down at all. As a matter of fact, our wait lists, the demand for services are higher than ever. So it's not really improving.
Why is it such an important conversation for families to have in terms of getting and seeking therapy?
Well, our biggest concern, I think, would be that these disorders can become lifelong, and we certainly don't want that to happen. So we'd rather intervene earlier and give children the tools and the resources they need to manage these things that they struggle with.
When you hear therapy as a recommendation for your child for the first time, it can feel overwhelming, right? And a lot of it is like, where do I even start, and what should that look like? So can you walk us through, what the different types of therapy for kids might look like?
And yes, and there are a variety of therapies available. Sometimes we have parents I think parents are very savvy these days too. They do a lot of research before coming in, and they might have something in mind that they feel would be a good fit for their child. We have a lot of requests for play therapy, which does take a special certification for that. A lot of therapists use play in therapy, but that's different than certified play therapy. We don't have anyone at KBH that is certified in play therapy, but we have many other evidence-based practices that we use. And I think typically what happens during the intake assessment, we ask questions, gather information about symptoms and history, and initial recommendations are made based on that intake assessment. And then when the family meets with the assigned clinician, there's an ongoing period of assessment, and they determine in conversation with the parents or family what the right fit for their child would be in terms of which practice to use.
And you mentioned play therapy, but there's also CBT and is it DBT? Can you talk just sort of a brief overview of what the difference is between those two?
Right. Well, cognitive behavior therapy is essentially helping people to reframe problems, to think about, to change thought patterns that aren't helpful to them. The thought patterns may keep them stuck in the problem. DBT, dialectical behavior therapy, is a form of cognitive behavior therapy. And dialectical means considering both sides of an issue. So, in short, more than one thing can be true. A good example for parents is many parents might agree that they love their child, but at the same time, their child drives them crazy on some days, right? So both things are true. And that's what's interesting about dialectical behavior. It's considering that more than one thing is true. And how do you manage emotion regulation or dysregulation around both things that are true?
Mhm. When it comes to therapy, to if you get to a point where that is really the best path forward for your child, for parents, a big question would be, well, should I be in the room? And
Mhm.
like, what's the right path forward for me when it comes to my child? Because you want to respect their privacy too, especially when they get older. But what advice do you have to give for parents about physically being in the room if they are undergoing therapy?
I think that many parents are surprised at the level of involvement that we request for therapy. And you're right, it does vary based on the child's age. So the younger the child, the more involvement the parent might expect to have. And the therapist will guide that process in terms of how much contact is needed, how much communication is needed, and all of that. As children approach adolescence, they are often ready for a higher level of independence and want some privacy in their therapy. I've talked to a lot of parents who believe that children will use therapy the same way that an adult would, and they often don't. And so parents might expect they're going to come in and talk about how their week was, and maybe sharing the things that didn't go well. And children typically won't do that. So if we're not getting that communication directly from the parent, we may not have the information.
So then, what does involvement look like for younger versus older? And what is it? I'm sure every child is different, but is there sort of a rough idea of age when, okay, there should be a little bit more independence in this versus I need to physically be in the room, I need to physically be involved in this?
Right. So definitely for younger children, for the parent being in the room is my preference. I I find it helpful if parents are learning the same skills that we're trying to teach the child, because that way they can reinforce those skills at home, encourage their child to practice. And so it does change as the child grows up or becomes a little bit older, but it also really depends on the developmental age of the child. So if you have a 15-year-old who has a developmental disorder, they might need more support from a parent or caregiver than a child without a developmental disorder.
So thinking in terms of teenagers though,
Hmm.
right? And this idea of independence.
Hmm.
And maybe you're not physically in the room with them, but what are some of the things that we can do as parents to support them in therapy without, maybe physically sitting right next to them in therapy?
And I encourage parents and teens, especially, to have a conversation about the level of privacy they both expect their teen to have in session. And I think that gives the teen an idea of whether the parent will be asking for their records, that kind of thing. We find that teens who have more privacy in therapy actually do a little bit better in therapy, but also some assurance to the parent or caregiver that if there's anything that it involves a safety issue, that is not information that will be kept from the parent. That information will be. So if their child was engaging in self-harm or at risk for suicide or suicidal thoughts, that information would be conveyed to the parent or caregiver
Well,
immediately. Even if the teen didn't want that to happen, that's not information that would be withheld from them.
yeah, no, of course. And it brings up a good point of, what should the relationship between the parent and the therapist look like? Like,
Right.
walk us through, how to best communicate with the therapist when your child is going through.
I think it would involve check-ins, maybe at the beginning or end of a session, between sessions if things aren't going well. The parent ideally would be involved in treatment planning, so that the teen would be able to voice their treatment goals, and the parent would also weigh in on that and let us know what's important to them.
So, what kinds of, information or observations that maybe we're making at home would be most beneficial to share?
So it could be anything, and it really depends on what the treatment goals are. If we have a teen in treatment who's, for example, struggling with having outbursts at home, we would be asking the parent to let us know if there's a reduction in the number of outbursts, if the child or teen is using skills more often, and that their observation of their child's progress.
When it comes to trauma or a
Mm.
child who is really struggling because they've experienced some type of trauma, often, not always, but often it seems like the whole family would be involved in some way, right? Like maybe it's a death of a close family member. I mean, it could be any number of things.
Mhm.
So, how can parents really also support their own mental health while their teen or their child, whoever it might be, is experiencing their own emotions at that time?
Hilton brings you new ways to stay, with experiences that let you capture the glory days. Introducing the Graduate Hotels. Each inspired by local college towns, these stays are always original and never boring. Get in touch with traditions all across the country and enjoy a stay that's a class above the rest. Book at Graduate Hotels with Hilton Honors Points at Hilton.com. It's a win-win. Hilton, for the stay.
We have a number of staff, and I'm going to give you a rough estimate. 15 to 20 of our staff are trained in trauma-focused cognitive behavior therapy, which is really the gold standard for complex trauma treatment for children aged 3 to 18. So it covers a wide age of ranges. It isn't unusual for parents or caregivers to also have experienced some level of distress from the traumatic event, even if not experiencing it directly. They may feel guilty, they may feel ashamed, they may feel they should have or could have prevented the issue from happening. So sometimes there is a parenting family component in TFCBT, to talk out things like parent communication with their child, how to improve the relationship. One of the biggest things that I think happens in traumatic situations is the family doesn't know how to talk about the event that happened, so they
Yes.
are prone to avoiding it. And so we would work on ways to communicate about it. And a big point of contention for families can be perception. And perception doesn't mean someone's not accurately reporting the event that occurred, but they're reporting their experience with the event that occurred, and that can look different. So we're having people be able to talk about their perceptions. And we want people to be able to talk about it at the dinner table. Well, mom, remember when this thing happened? And And the family can just talk about it rather than avoid and not engage in secret keeping, because that's not healthy or helpful either.
Why do you think it can be so difficult to talk about the trauma, whatever it might look like?
Well, sometimes I think it might be related because the parent may have their own trauma history that they have stuffed away and they haven't processed it or worked on that in therapy previously. And again, those feelings sometimes trauma can be it can impact multiple generations, right? So this can be sort of normative for families, that these traumatic experiences just sort of keep happening over and over and over again, and it isn't something that they've ever learned to talk about or to process. And I think one of the missing pieces sometimes for a family is the child understanding from the parent perspective about what happened and what the parent's doing to try to make sure the event doesn't recur. And I'm not saying that from a blaming perspective, but kids want to know what will happen in their life and what will be different and how they'll be safe moving forward. So these conversations are very important. And kids and families are experts at avoiding those conversations. So it's one of the big pieces in TFCBT to be able to process that together as a family and talk about it.
I would imagine too, like parents sometimes they don't know what to say either,
Right.
right? So, is it one of those things that even if you're bumbling your way through the words, that you should still speak the words so that you can get used to discussing whatever it might be?
Yes, I think that's a great point. And I think with practice, people get a little more comfortable
Right.
having the
But
conversation.
what I'm hearing is it's just you just have to start somewhere. It does not have to be
Right.
perfect, and it
Right.
might be quite sloppy,
Right.
But what I'm hearing is it really just in the end, it's just important to put the words out there, and
That's right.
that is an important part of the healing
Right.
process.
And the modeling from the parent is it's okay for us to talk about this. It's permitted.
Yeah,
Yeah.
that you're not shying away of it for it. You're addressing reality,
Right.
right? What have you seen as some of the long-term benefits for children whose parents are actively involved in their therapy or their mental health treatment?
Well, in terms of long-term benefits, the research on some of the evidence-based practices that we use, like MATCH or TFCBT, the research indicates that years later, that the children are still experiencing improvement, and the symptoms haven't returned. In the short term, these evidence-based practices help children faster. Their symptoms improve faster. It's hard for families. Nobody wants to think about being in therapy for years. So, ability to offer these treatments that can help improve symptoms in 10 to 20 sessions is pretty life altering for people to be able to seek improvement.
And I know, like, you said it yourself, you have long wait lists, and maybe you
Mhm.
can't go every week, or, maybe it's once a month, maybe it's every 6 weeks or every 2 months. So, what are the things that parents can do at home to reinforce the things that, they're learning or their children are learning in therapy without it feeling forced or overly clinical? You know what I mean?
Mhm. Well, I think parents often have homework too in these evidence-based practices. Match is a great example. So, if a family is presenting because they have concerns about their child's emotion regulation or behavioral difficulties, our initial work is going to be with the parents alone, and we'll give them homework assignments like noticing how often they make a critical statement to their child as opposed to how often they're offering praise. And we try to get them to change that ratio and offer praise more often. And then we might move to steps like spending one on one time with their child. And that can be for 3 or 4 minutes. And it doesn't involve a screen or anything competitive. It might be observing their child playing with blocks or Legos or drawing and having a conversation about the drawing, or maybe they set the table together. So it can be just these brief moments. And during that time, the parent is listening and offering praise statements in terms of what they're observing with their child. And then the hardest one that parents typically will talk about and seek support is active ignoring. So if the child is not, if nothing's on fire, there's not a bone sticking out and nothing's bleeding, we really ask parents to practice active ignoring. Children will do a lot to try to get our behavior. And it can be those negatively reinforced connections with the parent that aren't helpful. So if their child is engaging in those sort of nudgy behaviors, the more they can ignore those. And as soon as their child does something positive that they want their child to be doing, if you can be kind of all over that and give that attention, it works to sort of suppress the problem behaviors more quickly.
Mm. What I'm hearing too is, praise and spending this one-on-one time together. Ultimately, that is strengthening the parent-child relationship.
Mm-hmm.
That seems like, part of the goal in some cases when it comes to therapy, or it certainly seems like it would help.
Yeah, the parents are going to be there with their kiddos long after therapy has ended. And so that's really what we're looking for, is to strengthen these relationships between children and their parents in the long term. Therapy is brief, and we're hoping to give people skills that last for their lifetime to really help their relationships.
Yeah, which is so key. For any parent who is listening today and just kind of maybe overwhelmed, not sure where to start, what is one small thing that they can do to help support their child's mental health journey?
Well, I think parents can support their child when they're giving themselves a little bit of grace. I think parenting is the hardest job that anybody will ever have. I think parents are hard on themselves. I think society is hard on parents. The world is stressful on a good day, and I think parents giving themselves a little bit of grace and maybe observing all the good things that they're already doing with their child.
It's funny because that is a common theme that comes up with so many of these topics and these episodes that we do, is just giving yourself grace. Like,
Mhm.
so often we're just doing the best we can.
Mhm.
And also often feel like we are completely messing it up.
Mhm.
But as we're trying and we're learning, and just understanding that it's okay if it's not perfect,
Mhm.
give ourselves a little grace in these situations.
Absolutely.
Jacki, thank you so much. I do want to mention too to our listeners that we'll have more resources, more information on wgme.com/raisingme. Really appreciate your insight, Jacki. Thank you so much.
Thanks for having me.
Of course, a big thank you to Jacki for her guidance on this one. And, here it is again. But so important, especially as we are trying our best to support our kids who might be struggling with mental health challenges right now, is just that part and that reminder of giving yourself some grace as a parent. It is okay not to be perfect and to kind of feel like you're bumbling through this, right? But just as Jacki said, just being there. And in this case, whether it's physically in the therapy room or not, your presence is what matters the most. Thank you so much for listening to Raising Me. I'm Adrienne Stein. This episode is edited by Megan Littlefield. Thank you also to our sponsor, Maine Health. Please follow Raising Me wherever you get your podcast. And of course, consider a positive rating and review so others can find this message and Raising Me as well. Wherever you are, I hope you learned something new and get to take a little time for you.